table. Come and get those toes warmed up. And get a little bit of motion. Start warming with your toes. Get a little bit of air. Hands in the air. Like you just don't care. Turn to your neighbor and say, I was born a champion. Woohoo! All right. Give yourself a round of applause. That was good. Larry, I got one up here for you if you want. Yeah. Okay, welcome everyone. Thank you for being here. Got a fantastic workshop tonight. I'm excited. I'm excited for you, James.
Oh.
Yes, sir. You betcha. All right. So, who's here ready to learn and grow? Say aye.
Aye.
You know, there's an old saying: when you stop learning, you stop growing. When you stop growing, you start dying. Very good. Well, that's an encouragement to me because I learned a little bit studying for this workshop, and I'm excited to share with you. Next, by the way, if it's your first workshop ever in our office, raise your hand. Yes, we have one person. Beverly, everybody give Beverly a round of applause. This is her first workshop. Raise your hand if you've been to 5 or more workshops. 10 or more, 20 or more, 50 or more, 100 or more. All right. Give everybody a round of applause. Yeah. You guys are winners. You guys are champions. And I really appreciate that about you. That's an encouragement for me. Next month we have cancer prevention. So tonight we're talking about heart disease, which is the leading disease killer in the world. And a close second is cancer. So obviously that's an important one. Mark it on your calendar. And it'll be 4 weeks from today, I believe. What's the purpose of tonight's talk? Well, if you look at the picture on the left versus the picture on the right, and you had to choose one of 2 futures, everybody knows which one you would choose. Can you see the difference? Yeah. Right. And the thing is, it's what you do now. It's the decisions that you make now that are going to determine what that future looks like tomorrow. And so my hope, wish, and prayer is that you get a lot out of this tonight, and that it'll help you make intentional, better decisions. And if you make better decisions, you're going to get a better outcome and a better future. You're going to learn about what health is and what it's not, where it comes from, how to get it when you need it, and how to get the most out of your care here. Part of it is your adjustment, but also part of it is the shift in thinking and the ability for you to make intelligent decisions, not based out of fear, but based on the information that you get at these workshops, right?
Right.
And so, why your heart matters is because, it's 75% of all heart attacks that occur today are with people who have normal cholesterol and normal blood pressure. Did you know that? Yeah. So when it comes to heart disease and preventing a major cardiac episode that could cost somebody their life, it's got very little to do with what we've been told by commercials, TVs, doctors, friends, family. Tonight you're going to learn the truth, what you have to keep on your radar. 80% of these risk factors that we're going to talk about tonight are what? Preventable, using the core 4, the holistic approach. That's our system in Elevation Health. Function, fitness, nutrition, education, those 4 little icons there, which we're going to revisit. So the risk factors that put you and I at risk for heart disease, some are modifiable, some you can't modify. So the non-modifiable ones are what? Your age, your gender, your genetics, your race, ethnicity. You got to do the best with what you got. Not much you can do to change that. However, thankfully, 95% of whether or not we get heart disease or develop it or die from it is modifiable, which means you can turn off those factors, the genetic risk factors, your age, your gender. You can override that with the decisions and the actions that you take regarding your health. So starting with your blood pressure, right? Not smoking, your blood sugar, your physical activity, your weight, and your cholesterol. And by the way, what you're going to learn here shortly is that it's not bringing your cholesterol down. I'm going to say that again. It's not bringing your cholesterol down. Doing that will shorten your life expectancy. It may come as a surprise. Some of you, it's the first time you're hearing it. Others, you've heard it before, but you're still confused about it. So that's why I'm glad that you're here, because repetition is the mother of all skill. So you got to know your numbers, and I'm going to teach you the numbers tonight. If I had a nickel for every every person who brought me their blood work and said, hey, the doctor wants to put me on the statin medications, but I'm not sure, it says my cholesterol's high, it's got the red flag, and he said it's off the chart. If I don't take it, I'm going to die. Well, tonight we're going to set the record straight, and you're going to learn how to read those numbers. Some facts. High cholesterol is not a significant risk factor for heart disease. It's not a significant risk factor. So if the reason why you're on a cholesterol-lowering medication right now is to reduce your risk of heart disease or to lower the likelihood that you're going to have a heart attack, that's a waste of time. You've been misled. People with low total cholesterol have just as many heart attacks as people with high cholesterol. That comes in New England Journal of Medicine. So again, if your doctor has you on a statin medication or a cholesterol drug to prevent a heart attack, there's no evidence to support that. There's no evidence at all. Lowering your cholesterol to very low levels is very dangerous. You're compromising your brain. You put putting yourself at risk for Alzheimer's, dementia, brain damage, not to mention other side effects like lowering and weakening your immune system, which increases your risk of infections and cancer when you lower your cholesterol. So these are the things that have to be considered. And so let's, in your handout, which I don't want you to, come on up front. I got a seat for you right here. There's a seat right back there. Okay, you're good? Okay. So make yourself comfortable. In your handout, not that we're going to go through it now, but if you want to read, you'll see the history of, where some of this comes from, dietary recommendations and whatnot. But you can read that on your own, but I did some work and put that together for you for your own supplemental reading. Moving forward, when we look at some of the newer studies that are coming out, this was in the National Library of Medicine, they're finding now that higher total cholesterol concentration may be associated with better cognitive performance in your elderly years. So this is what they're finding now, that the higher your cholesterol, especially the LDL goes, they don't like it when it's over 100. That's when they want to put you on medication. But studies are showing now that the higher that goes, the better your brain works, and the longer it works good. And again, we talked about it also being a cancer preventative. So this is what the findings showed. That higher concentration of total cholesterol is a what? It's a protective factor for cognitive performance. What's one of the fastest increasing rates of disease is Alzheimer's disease. Now, how many of you guys, decades ago, two, three decades ago, 20 years ago, how many people did you see being diagnosed with Alzheimer's compared to today? How many people are being diagnosed with Alzheimer's today? Dementia, Alzheimer's, memory loss. It seems like it's worse than ever, doesn't it? Well, think about, the frequency of prescription with cholesterol medications. This is not all of it, but it's a big part of it. It's definitely a big part of it. When you look back in history and you see the advent of all of this. Another study from the American Journal of Cardiology, statin medications increase the risk of death. So they followed nearly 300 adults diagnosed with heart failure. They found that those who were taking statin drugs and who had the lowest levels of what? LDL. Is that the good or the bad cholesterol? It's the bad. That's the one that they're telling you to always get that down, or you're going to be in trouble, right? The people who did that had the highest rates of what? Mortality, early death. So here's another study out of a Japanese medical school. And this was not a small study. It's almost 12,500 people. They had to lab work, blood work. They looked at this study in 12 rural areas in Japan, and they found that low total cholesterol was related to high mortality. Same thing that they found in the American journals. High cholesterol was not a risk factor for mortality. Isn't this completely opposite of what you've always been told? Why is that? Why do you think that is? Big Pharma? Big Pharma? I was hoping more of you guys would. Some of you are afraid to say it. Yes, we're filming right now, but your life is not at risk. We live in a free country. You're allowed to say what you think. So this is it. Here's the Framingham Heart Study. This was one of the first major studies with the largest group of people that they put through checking for heart health, and then they followed up with 3 generations. They're on their 3rd generation now. Started in 1948 with 5,000 people. They're on their 3rd generation of following up with these people and their families. They noted this: for every 1 milligram per deciliter drop in cholesterol per year, there was a 14% increase in cardiovascular death. 11% increase in mortality in the following 18 years in those over 50. So if you're over 50, and again, you're trying to take your cholesterol down with drugs or supplements or a good diet, what are you doing to yourself? Nothing good. Yeah, dying early with a corrected cholesterol level is not considered a good outcome, is it? No. So in the past 30 years, there have been 44 randomized controlled trials that reveal no cardiovascular mortality benefit. In other words, there's not one shred of evidence that shows that if you're taking cholesterol-lowering medication, that you will live 1 day longer. After you've been on it for a year, 2 years, 3 years, 4 years, you will not live 1 day longer. And just as many people who have low cholesterol have heart attacks in the same frequency that have high cholesterol. So what's the benefit? What good is it? Well, according to this cardiologist, there's no benefit. Nothing. Not from lowering your cholesterol, whether it's a drug or from diet. So here's a question for you, just to make sure you're tracking. So if I were to ask you, what can I take to lower my cholesterol naturally, what would your answer be? Don't do it. Nothing. Okay, good. Good. We're all on the same page. Because, usually there's somebody in the room that says, supplements, like this supplement or that supplement, red brewer's yeast or something like that, right? And it's like, no, the answer is not taking something natural to bring your cholesterol down. The answer is to leave your cholesterol, leave your LDL where it is. Now, your HDL may be a different story, but your LDL, the reason why, and your total cholesterol, the reason why they tell you to get on the cholesterol medication, you're going to learn a whole different approach now. Are you ready? Just 3 more reasons to avoid statin drugs. They deplete your body of CoQ10. What is that? A necessary molecule for your muscles to work, especially your cardiac muscles. And statin medications actually strip that out of your body. So especially if you are a person or you have a loved one or family member who's on that, you have to make sure that they're taking that CoQ10. Otherwise, it's very dangerous. Also, statin medications inhibit the production of K2, which actually protects your arteries from calcification. Isn't calcification in your arteries a causative factor for, isn't that what leads to coronary artery disease? Yeah. So what is it showing? That it actually can cause heart disease, statin medications, because of this. And also it triples your risk of diabetes if you've been on it for more than 2 years. So again, if you are on any of these, listen, if you had high blood pressure, and I wouldn't tell you to stop taking your blood pressure medication. If your blood sugar was off the scale, I wouldn't tell you to stop taking your diabetes medication. But if any of you are on cholesterol medications right now, and you're thinking about stopping them, not only is it a good thing to consider, but there's absolutely no consequence if you stop, like literally today. There is absolutely no consequence. And if you read, if you go through with what I'm going to show you and learn how to read, you'll have peace of mind about it. Fair enough? Okay. Key points. LDL cholesterol plays a crucial role, we talked about, protective role in brain function and what else? Your immune system. Latest research on your optimal level of LDL is what? 139. So again, if you get your labs tomorrow and you're freaking out because your LDL is 120, right? Your doc says, oh, it's too stinking high. We got to get you on this prescription. Remember what I'm telling you. Remember what I'm teaching you now. This is the latest studies. The best predictor of the risk of a heart disease is looking at the ratio of your total cholesterol divided by your HDL. So you don't see LDL there. The best predictor of heart disease is by looking at your total cholesterol divided by your HDL. So here's what that looks like. On the left, typically when you get your labs, when it moves into the red and you see that red flag, you see your cholesterol. If it's over 200, then they're going to flag you. But again, that's not what is predictive of a heart disease. If you look on the right side, I'm going to show you here. Actually, if you, let's say you take a 240 total cholesterol and it looks high. You don't just look at that, you look at your what? HDL. You divide the HDL by that total cholesterol. And then, where does it fit on this scale? If that ratio is under 4, then you're still in normal range. You're still okay. as long as it's under 4. And some of the lab reports actually give you a reference range for that, and some of them don't. But if you can do simple math, you can figure it out, right? Okay? Here's an example. Cholesterol, 299. Holy smokes! That's too stinking high. You're in trouble, right? No, maybe not. Not so fast. LDL is 210. Whoa! That's a red flag also. Now here's your HDL. That's a red flag also. Why? Because when you take that 62 and you divide it by the 299, what do you get? A ratio of what? 4.8. And that is borderline high. That is not ideal. And so now, in order to improve that ratio, remember, you don't want to take your cholesterol down, but how do you improve that ratio if you don't want to mess with the total cholesterol? The only thing you can modify with good lifestyle is your HDL, right? The only reason why that ratio would be bad is because your HDL is not high enough, not because your LDL is too high. It's because your HDL is too low. Are you with me so far? Yes. So you never want to take the LDL down with a drug or a diet or supplements. You want to do things that will raise your HDL and improve your overall ratio. So how do you do that? Well, all the good fats. Avocados, what else? Some of the tree nuts, walnuts, macadamia nuts, walnuts, almonds, olive oil, right? Your Ultraplex EPA, the fish oil capsules, getting copious amounts of it. Now again, if your ratio is low, or it's too high because your HDL is low, or your omega-3 levels are low, you really need to take copious amounts of that. You can't just be popping one fish oil capsule a day. That may not be a therapeutic dosage to get the clinical outcome that you're looking for. Does that make sense? Okay. I have to do this too. I just got my labs back, and my HDL was 57. I was like, oh, wow. It's not like I'm not exercising every day. It's not like I'm not having good fats. I am. But am I having enough? No. So I started adding a little bit more. And so I'm applying everything that I'm teaching you right now. So another good index so that you know that you have a good ratio there without guessing is testing. And one of the tests we do is an omega-3 index test. It's a finger prick blood test. And it tells us where your omega-3 ratio is. How do you know, or what is the omega-3 ratio? Do you know what that is? Every cell in your body has a membrane, and the membrane on that cell is made up of fat. The membrane of that cell should be somewhere between 8 and 12%. Right? That's what the ratio should be there. And if it is, then the membrane is permeable, it's healthy. So it allows all the nutrients to get in. It allows all the waste and the toxins to get out. And all the hormones, your testosterone, your estrogen, your thyroid hormones, all that communicates with the surface of the cell as well. So isn't that important? Yeah, that cell membrane is healthy. Yet, who's doing that on their labs? Like your doctors aren't checking for this on their labs. That's why we do it here, because nobody's looking at it, and it's so vitally important, not just for heart health, but for your eyesight, for your brain to prevent Alzheimer's. Really, like in every basic fundamental genetic expression in your body to be working properly, it depends on this. So, as I said, the right ratio is supposed to be somewhere between 8 and 12%. In the U.S., most people are at 4% or below, which puts them at a 90% higher risk of sudden cardiac death. Did you know that? This is important. So, low risk is when you're up there. Moderate risk is right there between 5 and 7. And then your highest risk is going to be down in that area. But the question is, do you know where you're at? Some of you do, because we do this. If you're a maintenance patient in our office, if you've been under care for several years, we include this in your program. Now, if you haven't had it yet and you'd like to, we can do that for you. It's not a problem. Very simple test, finger prick blood test. We'll have it. And if you tell me, yeah, I'm taking a fish oil capsule, great. Are you only taking one? And your index is down at 4, what does that tell us? Not getting enough. If your HDL is 40 or 30, you're not getting enough. One isn't going to do it. You probably need to do like 3 or 4 a day. You probably need to get some more fish in your diet. but it actually gives you a target amount that you need. It prints it out right there. It's like, here's exactly how many milligrams you need in particular. And then you get it in your diet, do it for 3 or 4 months, and then you get retested. And then you know you're in the proper range. Make sense? What else do you need to look for on the blood test that most medical physicians routinely are not checking for, which is called C-reactive protein? Everybody say that. C-reactive protein. Otherwise known as CRP. And the only time that they routinely do that as a diagnostic is if you've had a heart attack. So C-reactive protein is an inflammation indicator. And inflammation, as you're going to learn here in just a moment, is one of the leading predictors of a heart attack and coronary artery disease. And you have to get that under control if you're really serious about your preventative routine here. And the New England Journal of Medicine, this was published decades ago, they said that inflammation is an independent risk factor for heart disease, much stronger than any measure of what? Cholesterol. Patients with low C-reactive protein had fewer heart attacks, no matter what their LDL cholesterol was. And people with higher, the more heart attacks, they had more heart attacks if their CRP was elevated. So if their CRP was low, didn't matter what their cholesterol was, they had fewer heart attacks. If their CRP was high, it was very predictive of what was going to happen. Make sense? So this is what it looks like. Again, a finger prick blood test, very simple. And it gives us a readout. The other thing that this test does is it gives us a vitamin D reading as well. Isn't that important for heart health? Yes. So those two, that's why they come together, because it's really a heart smart test. So, and this is something that normally we do this annually for our patients. And again, if you haven't done it and you want to do it, we can do that. You don't have to wait. But it's something that you should know your numbers. If you're getting a vitamin D and it's in normal range, and your doctor gave you your labs and it's like 30, and they said, okay, you're in normal range, no problem. Well, that's good, but it's not great. If you're looking for your immune system to be in optimal health, your heart to be in optimal health, there's an optimal range for vitamin D rather than just a normal range. Normal may be between 30 and 40. Ideal or optimal is around 70. And so again, you have to know your number so that you know that you're getting the right vitamin D dosage. Some of us take 1,000 milligrams with our Centrum. Some of us take 5,000. I've seen people taking 5,000 international units every day and still be in the lower range. Everybody's different, and you just don't know until you get tested. That's why we take this seriously, and we do it for everybody, because it's very important. We're talking about the leading disease killer worldwide, right? Kind of important, wouldn't you agree? So when we talk about integrative support, that means making sure that we're looking and doing from all ends. We said the core four: function, fitness, nutrition, and education. Recapping what we say, that lowering your LDL cholesterol does not stop the progression of heart disease. Everybody got that, right? So at this point, if you're sitting in this class, and the next time you have a visit with your medical physician, you want to be looking for these things, and you want to be prepared to make that decision. Now, hopefully your doctor is, on your team. They want to help you make a good decision, and you have the right to ask questions, and you have the right to make your own decisions, and nobody here should be berated or felt to be made feeling inferior or not adequate enough to make that decision. The doctor should be supportive of you. And the more information that you have, and when they see that you're an informed consumer, guess what? They're less likely to push you to do something that you don't want to do. All right? That's the whole reason why we do these workshops every month. Because the more you come back, the more you're going to be comfortable with it, and the more you'll be better suited to be able to ask those questions and make those better decisions, right? Heart disease can be reversed, yes. Studies show that people who apply these lifestyle changes have the reversal of heart disease, have the reversal of clots, have arteries open up, 100% reversible. Over time, it can be done with the application of the core four. So what do you have to do? What has to be on your radar? Okay, it's not just about what not to do. it's also about what to do instead. So I'm going to give you two things. How many things? Two things. That's it. Two things. And it's not lowering your cholesterol. It's not lowering your blood pressure. It's these two right here. You have to address these. If you're serious about heart disease, this is what all the research points to right here. Insulin resistance, right? Restoring insulin sensitivity, which is metabolic, right? Which means controlling your what? Blood sugar. Yeah. And then also chronic inflammation. Now, those two are intertwined. Those two are two peas in the same pod. However, there are other factors which can cause them to work independently. And I want to go into those three factors right now with you. Stress. Stress increases a hormone called what? Cortisol. And cortisol increases inflammation. And what does inflammation cause? Insulin resistance. Yeah. That's why when you're stressed out, you see people stressed out, they gain what? Weight. But what you don't see is what's happening on the inside. You don't see the inflammation that's being driven by the blood sugar. You don't see the inflammation, the fatty liver disease, the heart disease. You don't see that on the inside. But you can see it on the outside, and it all starts with what? Stress. So it's not from the fatty foods. The clotting that happens inside, it's not from the fatty foods. It's not from high cholesterol foods. It's not from saturated fat. It's not from eating your steak or your eggs or your bacon. That's not what causes high cholesterol, and that's not what causes heart disease. What causes the clotting is something called fibrin in the blood, which is triggered by stress. That's it. Stress. The inflammation is what causes this whole process. So what are the biggest contributors? Yeah. Are you a contributor? Do you give stress? Do you give stress? Or do you receive stress? Or a little bit of... I know the answer, Bruce. He always has the right answer. So, too blessed to be stressed. Like everybody's different on how they handle stress. But we all have stress. You don't live on planet Earth in this life and not have stress. We all have stress. It's how our body handles the stress, isn't it? Right? How we respond to it. But my point is that managing your stress, Beatrice, stress reduction. Why did I just call your name? I'm causing you stress right now because you're falling asleep on me. That can have a huge impact. That's just stress just went up. Because it can have a huge impact on the prevention of heart disease, right? So let's talk about that for a minute. Sleeping. Sleep deprivation causes insulin resistance. Did you know that? Sleep deprivation causes insulin resistance, and it causes chronic inflammation as well. So it's super, super important to make sure that at some point you get that under control. Sleep is vitally important for you to recover, heal, manage stress, other things like meditation, deep breathing, journaling, prayer. I don't have to preach to the choir, but the word says it all. If you know what the truth is the word of God, then you don't have to worry and try to find out what the right answer is to solve the problems of stress, because it says in Colossians 3:15 and 17, and let the peace of God. The only place where peace really comes from is from God. And so in order to have peace of God, you have to have peace with God. And what does that mean? The Bible says that to know the Lord, you have peace with Him. That means you're saved from your sins. Jesus is your Lord and Savior. And, now you have a personal relationship. And you know the love of God. Right? So just like a little baby has peace because of the mother's love, unconditional love. You are unconditionally loved by God. And when you know that love, you can't have love and fear. You can't have love and stress at the same time, can you? No. Because perfect love casts out all fear. And so, that's starting with that, to which you're also called in one body, and be ye what? Thankful. Can you be thankful and stressed at the same time? No. That's why all you need is the Word, because it shows you. God gives you the clear instructions in the Bible. It's the user manual. Let the Word of Christ dwell in you richly. The Word is the truth. It's the user manual for your life. What to do, what not to do. And the more you read it, the more you understand, like, hey, I don't have to guess, I don't have to hope, I don't have to wish, I don't have to make this up. It's right there. Teaching and admonishing with grace in your hearts, whatsoever you do in deed and in word or deed, do it all in the name of the Lord Jesus, giving thanks to God and the Father by him. Giving thanks. Everybody say that word. Giving thanks. Giving thanks. Right? We enter his gates in thanksgiving. Stress starts with not continuing to look down, but looking up. And that's where your peace comes from. And so, when you don't have that, then it's really hard for you to manage your stress. You can do deep breathing, you can do yoga, you can exercise, but if you leave this piece out, you're leaving out the most important piece of the puzzle. This is where it all starts. It starts and ends with this. Your last day, the last breath you take, you got to know where you're going to go. You have to know who made you and why you were created in the first place. The most important days in your life, the day you're born and the day you find out why. And also, beyond that, knowing what comes after. And the reason why you're here breathing now and you're still on planet Earth, because God's got a plan for you. He's got a purpose for you. And you got to know that. You got to connect with that and stay connected with it. And what you do with that is up to you. But hugely important. Again, how is it that 75% of the people who have heart attacks have normal blood cholesterol and normal blood pressure? Because of what? Because of this. Their body's inability to handle it. So, exercise is important? Yes. Exercise will help you manage stress. Studies show 150 minutes weekly, a moderate activity. You want to get a couple of days of resistance training in there. I've been talking about this at every workshop, so a brisk walk is good, cycling, swimming is good. These are all good things. But you want to start engaging in resistance training. All the studies that are coming out, all the anti-aging studies that are coming out, preventing Alzheimer's, dementia, strength training is behind that. And I'm not talking about becoming a bodybuilder. I'm just talking about heavy hands or just using machines if you go to a gym. Just start getting into some strength training, because everything is pointing to the benefits of that being so necessary that you can't get just from a brisk walk or aerobic activity. So that's how you would want to mix it up. It improves your insulin sensitivity. Again, we're talking about heart health, and lowers your blood pressure and stress. And what else does exercise do? Just like the good fats, it raises your HDL, to improve your overall cholesterol ratio. Is this starting to come together now? You see how it's all intertwined? Okay. Well, I know some of you guys are so you're yawning, you're falling asleep, so I'm not gonna let that go on. I got to do something to keep your attention here. So, okay, so we're going to recognize a couple of special people here. And first thing I want to do is recognize people for their perfect adjustment attendance. And so there's a couple of folks here who have been absolutely stellar. Perfect, on spot, on time. And we love seeing that, because when you are perfect with your adjusting schedule, you always get the best results, and we celebrate that. We love that. And we just want to recognize you for that. We have James Johnson and Larry Fontenot. Everybody give them a big round of applause. Yay. Yeah. Okay, now we have a special one here. This is our Elevation Health, thank you, Elevation Health University Core 4 degree. Elevation Health University, a Core 4 degree. We have a graduate here. Doesn't mean you stop coming to workshops. This is for attending 6 or more workshops. This is to Graham Booth. Everybody give Graham a big round of applause. Excellent. Excellent. Appreciate you guys. Keep up the good work. All right, so, there's an old saying, the mind can only absorb what the seat can endure, right? So we're going to lift you up off the seat, turn you to the right, put your hands on your neighbor, on their shoulders, to the right side. And wake them up. Wake them up. Don't hurt them. Just wake them up. Squeeze their shoulders. Squeeze the shoulders. Squeeze the traps. Wake them up. Get some blood going. Okay, karate chop. All right. Good. Good, good, good. Awesome. Are you awake? Good. Turn around and love your other neighbor. Get that blood going. Wake them up. Wake them up. All right, karate chop. Good job. Give yourself a round of applause. Okay, we've got a few more slides to cover here. He gives a good massage, doesn't he? Yeah, you got a good. All right. So what does it say? 75% of heart attacks are triggered by the autonomic nervous system. Now, just a few moments ago, I said 75% of people with normal blood cholesterol and normal blood pressure have heart attacks, right? And the reason why is because of stress. What manages stress? Your nervous system. In particular, something called your autonomic nervous system. Everyone say autonomic. Autonomic. Autonomic is like automatic. So there's two parts to your nervous system. You have the sympathetic, which is the fight or flight, which is when you're super stressed out. That thing is in overdrive. It raises your respiration rate, your blood pressure, slows down digestion, revs up your adrenal glands, causes cortisol to release, causes inflammation, causes weight gain, right? Lack of sleep, all of that. And then your parasympathetic is the other part, which is the rest and digest. That's what slows everything down. And there's two different parts to that nervous system. But when that fight or flight is in overdrive, that's where people get into trouble, especially with heart attacks, sudden cardiac death. What's the number one factor? Your heart attack risk is primarily dependent on the what? Normal functioning of your nervous system. Remember I said we can't stop the stress, but if your nervous system is what is allowing your body to adapt to that stress, as long as you got it working the way it's supposed to work, the way it was created to work, you can handle that stress better and not blow the breaker, so to speak, because your nervous system is electrical in nature. So most of you here are familiar with this. That's the autonomic nervous system chart. Do you see the yellow nerves that branch off from the spine out to the organs? Mm-hmm. See all the yellow nerves? You see the blue nerves that come off there also? What do you see more of? The yellow, right? That's the sympathetic. That's the fight or flight part. The parasympathetic all comes off of way up at the top of the neck. You don't see any blue nerves except way at the bottom there by the sacrum. Most of those blue nerves come right off the top of the neck, right here by the atlas. And so the atlas is the top bone in the neck, and right in front of the atlas you have the vagus nerve, and that vagus nerve comes down, and it runs that parasympathetic part of your nervous system. Are you following me right now? Say yes? Yes. Okay. So here's how this plays into your health. First of all, what's the definition of health? Is it feeling good? Well, I mean, you can feel good and still have a heart attack, right? Mm-hmm. You can feel good and still develop cancer and not know it and have no pain at all, right? So feeling good is, it's important, but that's not the definition of health. You can actually feel lousy. You can have a headache, but your body could be fighting off cancer. Your lower back can hurt, or your knee could be blown out, but your immune system could be off the charts. You haven't had a cold in like 10 years, right? So there's a difference between how you're feeling and how your body's functioning, right? And so the true definition of health is when your body's functioning at 100%, right? So Pauline, if your heart's functioning at 100%, what's the likelihood you get a heart attack? Little to none, right? And so Laurel, if the cells in your colon are functioning at 100%, what's the likelihood you get colon cancer? Zero, little to none, because God doesn't make junk. So that's the idea. If you want to assess your health, if you want to make sure that you're doing the best that you can, that your body's performing at the best it can, it starts and ends with your nervous system. So, what's the difference between you, who's breathing right now, and a person with a toe tag, somebody who's dead? Somebody who's in the morgue, they just died yesterday, they still have blood in their body, they still have a heart, lungs, liver, spleen, kidneys, they still have all the same organs. They have a nervous system, they have a brain. What does a dead person not have that you and I have? Life. Very good. Everybody say life. Life. So what is life? Well, life is it's like an intelligent expression utilizing your nervous system, which is a conduit, to allow the body to adapt to its environment. there's a life expression that uses your nervous system. Your nervous system is dumb, it's stupid, because a dead person has it also. But a dead person does not have that life, that intelligence that animates you as a living being, that uses the nervous system to control and coordinate all the functions at all time in all cells and tissues in your body, which you are not consciously aware of. That's why they call it autonomic, right? So that system has to have no interference for you to be functioning at 100%, for you to be 100% healthy, Beverly. Make sense? Yes. That's a good question. That may be a horizon that we never arrive at, but it's something that we shoot for. But we can look at your nervous system and see if there's any interference in it. There are other factors that can affect it, which we're going to talk about. But that's a great question. That's a great question. Nina?
I didn't hear her question.
So the question was, is it possible for somebody's nervous system or for us to function at 100%? Wouldn't you want to know the answer to that? Yes. Now, do we live in a perfect world? No. We don't? Come on, man! Okay, so there's no perfect people. There's an ideal. This is what I was saying. There's an ideal, and this is what we strive for, and with all of the core four: function, fitness, nutrition, and education. Our job is to, we'll look and see and assess the nervous system to see and utilize the best technology we have to make sure that we address any interference with that. But at the same time, there are other things in our environment, toxins, stress, traumas, all those things they come with the package. And you just have to deal with them best you can as an individual, and that's what I'm here to help you with. So you got that. So life resides in the brain, and it comes down through the spinal cord and out through the nerves, and that's how your body adapts to stress. Are you with me so far? Okay. So that's important because we come to this thing called Atlas. Everybody say Atlas. 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 Sing it. Judith is always here to sing us the Atlas song. So the thing with Atlas is it's the top bone in the neck. And it's the only bone without a disc above or below. It's only connected by ligaments. Ligaments are easily damaged, and it creates more motion there. And the spinal cord, basically, you have the most nerve fibers in that area. The atlas wraps around the spinal cord, the brain stem, and it has the most amount of nerve fibers with the least amount of room in there for misalignment. And so when that happens, if that atlas shifts, and when it shifts out of alignment, it puts pressure on the spinal cord, and the vagus nerve that comes out in front of that atlas can be affected. If it changes the tone of the vagus nerve, that affects everything through your nervous system. It frays your nervous system out. And that can be a causative factor for your body not being able to handle stress properly. Does that make sense? But if you address it, the opposite can come into play as well. So it's a misalignment of the top bone in the neck. So let me ask you, if you have an atlas subluxation, how does that affect your nervous system? How does it affect your nervous system? If your nervous system, its job is to enable your body to adapt to its environment, how does it affect the nervous system if the atlas is out of alignment, now impeding the life trying to express through that nervous system? Shuts it down. Now you're not functioning from an ideal perspective of the body being able to adapt to its environment. If your body can't adapt to stress, are you less likely or more likely to have a heart attack? So now you're starting to get this. Is that what's happening? See? These are some of the major symptoms, most common symptoms that we see with an atlas subluxation. Your immune system weakens. More chronic colds, flus, infections. Some of you guys have been patients here for 10, 20 years, and since you've been getting adjusted, you hardly get sick at all, right? You've noticed that. Even if it's been the last 2 or 3 or 5 years, you've noticed that. Because every time you get on that table, what am I checking? Pauline gets on the table the other day. She's like, can you please check my atlas? Man, if every patient said that to me, I'd be feeling good. Yeah, that means you get it. You understand. That's why we get adjusted. That's why I get adjusted. When I go to my chiropractor every Monday at 10:30, he checks my atlas. And, so this is it. For us, it's preventative. And if I do have to adjust your atlas, what are we doing? We're preventing what normally in the normal course of events with most people over time, it develops into heart problems or immune problems, mood problems, sleep problems, facial problems, mood problems. We had a rough week last week with the world events and everything going on. I don't need to go into specifics. I would just say that there were probably more firearms carried into a church on Sunday, this past Sunday, than probably ever in history. But the pastor made he made a good point. He said, I'm not against, defending yourself. We have to be responsible and understand the world that we live in today. But at the same time, it's not flesh and blood that we wrestle against. It's principalities and evil forces. So if the person who pulled the trigger and assassinated the person last week, if you pull a gun on somebody and you kill that person who's about to kill somebody else, you're just firing on flesh. Your Smith & Wesson is just firing on flesh. You're not getting to the cause of the problem. You're not getting to the evil, right? Because it's a spiritual battle. And I started thinking about that. I'm like, that's true. Evil uses people, right, to get the job done. Evil uses people. But it's choice we allow in our lives to be used by evil, number one. And number two, if you are sick, if you are in pain, if you're chemically imbalanced because of an atlas subluxation, you tell me, who does evil have a better chance of using? The sick and subluxated person or the person who's clear neurologically? And that's what I was thinking about also. What would this world be like if more people had healthier nervous systems? If everybody had their atlas checked and they were clear neurologically, and they were equal to the expression of life that God had created them with, not an abomination of that, and that God could work through them instead of evil, what would this world be like? It would be different. There'd be less hate. There'd be less crime. There'd be less problems, for sure. Now again, is that an absolute? I'm just telling you the ideal. All I know is that there's not one person on planet Earth who gets off an adjusting table with an adjusted atlas who's not better off than before they got on. Right or right? Right. Yeah. And that's the big picture. There's God knows how many people out there that are like that need to be adjusted, and who knows what they're going to do tomorrow? Who knows where the road that they're going down? And I know what can be done to prevent the likelihood of that. Just one adjustment away, many of them. Just one adjustment away, an atlas adjustment, right? So we said, how does it affect your nervous system? We know what it does to your risk of heart attack, but what does regular chiropractic do? Regular chiropractic care promotes autonomic nervous system balance, and guess what? If it corrects your nervous system and it corrects your body chemistry, it's not affecting your cortisol. It's affecting all hormones. And in effect, if it does that, it's helping with insulin sensitivity, and it's also helping with inflammation. Now, I told you guys I was going to make the connection here with the atlas subluxation and heart disease, and that just happened. Should I drop the mic? No, I'm going to keep going. No, I'm going to keep going. There we go. So what's the purpose of a chiropractic adjustment? To keep you reconnected to the source. Everybody's got life. Life is in your brain. It's 100% in the brain. The question is, what percentage is it out in your pancreas, in your heart, your liver, your spleen, your big toe, and your leg, and your foot, right? What percent do you want out there? You want 100%. So what's the purpose of an adjustment? Is it to crack your neck or your lower back or make your knee feel better? Is it cracking your back or your neck for pain relief? It's to correct subluxation, to remove interference from your nervous system so you can express 100% life. And that's healthcare. That's the cause of health, and that's healthcare. By the way, that's my family down there. If you guys didn't see, I put the picture down there because my wife's been getting adjusted since she met me 26 years ago. And how long do you think my boys, they're not little kids anymore, they're all several inches taller than me. How long do you think they've been getting adjusted? Since literally since minutes or hours since they were born. And how many times have they been to the doctor? Just for stitches? That's it. Never went to the doctor for drugs or medication or illness. Never had a drug in their life. It's all preventative. when it's applied properly, you save time, you save money, you go to doctors less, you go to hospitals less, and that's, that's something that you do, preventatively, as long as you possibly can for the rest of your life. And so when we talk about subluxation, it can occur not just at the atlas. You've seen this chart before. Your spine is like a circuit breaker. Certain nerves branch off and they go to different organs. Yeah, subluxation can occur at those levels also. But the most common area is where? At the atlas. Yeah. So here's one right there that goes directly to the heart and the lungs. But every time you come in, I'm checking all the circuits to make sure that they're clear. What causes subluxation? What causes the atlas or the vertebrae to shift out of alignment? How about sleeping on your stomach? It's very similar, when a baby's born, when they're pulled out by C-section or hands vacuum extracted forceps, that's when the first subluxations occur, during childbirth. Some of you have grandchildren here. Your children are grown, but you have grandchildren. And your kids don't know about what we're talking about. Don't you think they should know and have their kids checked? It's worth mentioning to it. It's for the future health of your grandchildren. You want your grandchildren to be healthy, right? Of course. So first subluxation is childbirth. 90% of childbirths, the kids are subluxated. And that atlas area is intimately involved with the immune system. So chronic colds, flus, ear infections, asthma, allergies, a lot of that's usually connected back to the atlas, to the subluxation there. Yeah, little traumas, you got major traumas. So what's the cause of it all? Stress. Some are big stresses, some are little stresses, but making sure that you're getting checked on a regular basis addresses all of this and makes sure that you stay as healthy as possible for as long as possible. And this is something called the safety pin cycle. Remember I told you in the beginning, your future gets decided with the choices that you make. You see the picture in the upper left-hand corner, right? I know what everybody wants, but it comes down to the decisions. And the decisions that you make come down to your understanding. And I need you to follow me here because this is the most important thing that I can teach you tonight. Are you ready? Are you ready?
Yeah.
Okay. So everybody's looking for the cure. It comes from an exotic fruit from the jungle and who knows where, and there's always some sort of noni juice or some supplement or something to take, and it's like a magic thing that'll cure you. Well, listen, if there's going to be a cure for disease, there also has to be a cause for health, right? And if you're just trying to cure disease from the outside in, you're really just treating effects. You're not correcting the cause. And the only way to understand how to correct the cause of disease is to start with understanding what's the cause for health. If something or someone is healthy, it's because of a state of health, where the body's functioning 100%, where the brain is communicating with the body, the cells. And 100% of that life is getting from the brain into the cells. The cells have 100% life, the brain has 100% life. That's a person that's healthy. Because the cause of health comes from above down, inside and out. Are you with me so far? And so if you've got 100% health in the cells, the brain needs to know about that. If you don't have 100% health in the cells, the brain needs to know and make amends. But there is a cause of disease. And really, it's only when you interfere with this normal, natural process of health. Disease is a condition as a result of an interference to the cause of health. So disease is dis-ease, dis-ease, a lack of ease of life flowing from the brain into the body, right? And what can cause that interference of life? Subluxation. Subluxation. If you're pinching the nerve and life travels through the nerves, if that pinching of the nerve is choking off life, what is it slowly doing to you? Killing you. If you're choking off life, it's killing a person. Well, it's killing the cells. This is what happens. So if there's 100% in the brain, and there always is, it's never less than 100% in the brain. Now, if studies show that the weight of a dime on one of these spinal nerves can shut off 50% of that nerve supply in 3 minutes, what are those cells doing? They're dying. Those cells are functioning 100%, and they're in your pancreas. You're on your way to diabetes. If they're in your heart, you're on your way to a blood pressure or some kind of heart problem.
if they're in your pancreas or your colon, you could be on your way to some kind of cancer, right? The cause of disease. The cells are dying. They're out of communication from the brain. And so when you have that condition, remember, disease is a condition. It's not a thing that you can kill with a drug or radiation or chemotherapy because it's not correcting the condition, right? So when you have that, you go to the doctor, the standard of care in medicine is not to correct the cause. It's not to restore health. It's just to treat the what? The symptoms. The symptoms. So you get some prescriptions or whatever else they do. Now, I'm not saying there's not a time and a place to do this, but all I'm saying is that, is it correcting the cause? If the cause is a miscommunication from the brain to the body, or the cause is a lack of life flowing into the body, it's not correcting that. It's not correcting, it's not restoring the body's normal condition of health, right? And so there are many different things that you can do. Some doctors, medical doctors, well, there are some medical physicians that are actually cracking people's backs now because they see the relief that people get. Chiropractic manipulations to what? To treat back pain. But it may not be correcting the cause. Just because you're manipulating the spine, it doesn't mean you're correcting subluxation. It doesn't mean that you're removing the nerve interference, does it? No. But when you do, then what happens? When you remove the interference and you restore the life expression from the brain to the body, now what happens? Healing. Healing. You're restoring the condition. You're restoring the cause for health. Can't be done from the outside in. Can only be done from the inside out. Can't be done from a pill, potion, lotion, or a supplement. If you had $100 to spend every month, and that's all you had, and you spent it on supplements, and you left that atlas subluxation torquing and jamming into your brainstem, would that be a good decision? If you had $100 and you could only spend it on, you only wanted to spend it on the membership in the gym to go work out, but you left the atlas jamming into your brainstem, is that a good decision? No. The most important investment that you can make in your health, which should have preeminence, I'm not saying all those things aren't important, they are, but the preeminence in that order is proper nerve supply, and eat good and exercise and take the supplements. I do all that stuff. But I never put anything of importance over and above that adjustment, because when you clear that out, then what happens? Well, are you saying the adjustments can cure my high blood pressure? Can the adjustments cure my diabetes? No, it's not a cure. What are we doing? We're removing the interference to allow the body to function normally. And in that course of events, over time, what do we see? Everybody heals differently. But I'll give you an example.
So, please state your name and rank.
James Jackson.
So, James, you've had some great results here in the office. You've only been under care, 4 or 5 weeks or so. And so what were some of the issues that you came in with?
I came in with high blood pressure, constant headaches, lower back pain, and just felt blah.
So how are things coming along for you since you've been getting adjusted?
I feel great. No more headaches. I'm off my blood pressure medicine, and my back is feeling really good.
Awesome.
And actually.
So there's an example. Does that help you guys better understand how to use the adjustments? Right? Does it start to make sense? Like the tool will work its best for you if you know how to use it best. And this is what it's best at. Keeping you and your family healthy. So, if you're a guest here, if you haven't had the testing done, the thermal scans, x-rays to look at your spine and see if you have any interference, you may have headaches, you may have neck pain, you may have sinus trouble, whatever. That could be caused by a problem in your spine. But even if you don't, how often do you go to your doctor for your checkup? How often do you go to a dentist that they check your teeth? Do you do it after you have a cavity or after when's the smartest time to have your checkup? Before. How much more valuable is it to prevent problems than to treat them after you have them? So that's why all of you here who are under my care, we do this at least annually. We'll get a new updated set of films because we don't guess. Your health is too important for that, right? But if you're a guest here and you haven't done that in a while, we have something called a Friends and Family certificate. This Health Pass will allow you to have the full workup The consultation, the exam, the x-rays, the report of findings could be up to $500 worth of service for only $97. Now, for those of you who are guests in the room, ask them before you leave. They'll give you one of these. They'll show you how to use it. And then I'll go over the results with you and tell you what the report is. Whatever it is, at least you'll have a knowing and understanding and not guessing with your health. If you have family members, friends that you believe should have been here, and you would like them to receive this, ask them for one of these. We're happy to help you. You want to pass it along. If it's something that they want to get help with, see if you can get use out of that, and we'll try to help you with that. So I like this because if you watch that, it's an animation of what happens with a person's posture if they're not taking care of it and how they age. And this stems back from medical research published in the Journal of the American Medical Association decades ago. They said, in general, there's a correlation in body structure, health, and span of survival. How many of you have seen people with really bad posture like this? And they're not, many of them are not very old. Their posture is horrible, but it ages them tremendously faster. Many of them, they carry they drag an oxygen tank because, especially up here, studies show the nerves that go to the heart and the lungs are affected when you have that forward head posture. And so this is really important. That's why studies show, conversely, chiropractic patients 5 years or longer, and this study showed that they had a 60% fewer hospital admission rate, 62% less surgeries, 85% less pharmaceutical costs. This comes from an actual study where they looked at people under regular chiropractic care, wellness care for 5 years or longer. So you guys you're applying this, and the longer you're under chiropractic care, the bigger the benefits are going to be for you. So that's it. It's like you guys are part of this. You're here. You're enjoying this now. Is this valuable? Are you finding this important, valuable? I mean, who deserves to know this? Really, everybody, right? So I want to encourage you to be a force for good. So how do you do this? I mean, it may be hard for you to explain. You use the word chiropractic to your friends and family, and what are they going to say? Well, my back doesn't hurt. Did we even talk about that tonight? No, it's all neurological. And it's about being at your best. You watch the football games on Sunday, and even Drew, what's his name? The quarterback. He's doing the broadcasting now. Tom Brady. Yeah, he said he made a joke. He's like, the guy. I mean, it was a serious impact. 2 helmets ago. He's like, well, that chiropractor for that team is going to be busy tomorrow. What does that say? Every team has chiropractor. When I was the team chiropractor for the arena football team and the Dolphins, I used to go and adjust them before the games, so that they would perform at their best.
Can you go now?
Can I go now?
For the Dolphins?
Yes, I would like to. I need to. I definitely need to. Bring people next month with you to the workshop. Next month is cancer prevention. If you have an event at your place of work or worship, wherever you want me to come speak there, I can do that also. We need to get this stuff out there. It's really important. Let's just finish up with this. Weight loss is a really important part of what we're talking about right now, because this right here, you see that? What is that? Fat. It's 5 pounds of fat. If I threw this at you, it would be painful as you caught it. Most people are walking around with at least 10 or 20 of these, 30, sometimes 40 of these. And what you don't know is that it's not just about what's jiggling around and causing your pants and your clothes to be tight. This is what drives inflammation. It drives inflammation. It's a hormonal system. And so what we're talking about with heart disease, you can lose weight. It shows, like studies show, if you lose 10 pounds, you double your chances of normalizing your blood pressure. If you lose 22 pounds, you reduce your heart attack risk by what? 75%. Yeah. But the trick isn't just losing weight, it's losing the what? Fat. If you don't lose, if you lost 20 pounds on a scale and you don't have a means of predictably knowing that you're not dumping muscle in water, then you don't know if you're losing the fat or not. But we have a predictable program that we have our patients who are looking to target this. There's a plan, there's a food plan, we weigh them in. We have the biometrics which show your body fat mass, your index, your body mass index, shows your muscle mass, your water, your metabolic age, and we check this. So when you're losing 20 pounds, you're not just watching your weight go down. You're watching your water go up, you're maintaining muscle mass, and you're watching the fat mass go down. Are you with me so far? Yes. So it's very different from a weight loss program, but I wanted everybody to be aware of this because I get this all the time. You know, I need to lose weight. I need to lose weight for my back, for my knees, for this, for that. Well, you need to understand that we have a plan that actually addresses this. It comes with a manual, a journal. There's a food plan. There are supplements that go with it. It's a 40-day plan. There are follow-up weigh-ins. It corrects your metabolism. It addresses everything that we talked about tonight as far as insulin sensitivity, reversing type 2 diabetes, inflammation, and we give you a guarantee. If you don't lose, at least 15 pounds, we put you through a second program at our expense. I just want to share this real quick.
Hi, my name is Linda Tomlinson. I've been a patient of Dr. Yachter for probably about 3 years now. I initially came to him for chiropractor needs, and I went to a workshop and they were talking about a weight loss program. I normally don't try weight loss programs, but everyone I've tried thus far never worked. But I decided to try it anyway, and I tell you, it was the best decision I made for my health. I don't only have to take the diabetic medication anymore. I lost the weight I wanted to lose, and I have kept it off for a couple of years now. Deborah is very knowledgeable. She will walk you through it. It's one of those things where it's a matter of life, because we want to be able to keep the weight off and eat healthy, and live longer, basically. So that's what you guys. I'm going to suggest that you guys try it because it really worked. I've sent 4 people that I know that have went through the program, weight loss program, and they look wonderful. So just letting you know, I'm suggesting it. I put my life on it, and I did, and I got the best results. So you guys should try it. Just want to let you know, I'm grateful.
So if this is something that you're interested in, what we do is we start with a weigh-in. You take your shoes and socks off. We get all the biometrics. We review it with you and see if you're a candidate for the program. If you are a patient under my care currently and you've never had this done before, we will do this the first time for you complimentary if you're currently under my care now, active care. If you've already had it done and you're under my care, it's normally $99. If you sign up just because of the event tonight, it's only $37. Anybody here is eligible for that. And then once we get the results, we'll review it with you and tell you if it's a good fit for you, if you're a candidate. There is a special right now. It's $300 off the program. That's good until, I think, next Thursday. But just see Deborah and tomorrow on the way out, and they can help you with that if that's something that you're interested in. Just real quick, so nutrition-wise, I want you guys to have a target to improve with. This study, New England Journal of Medicine published this in 2013, 5,700 patients, and they were all considered at high risk for developing heart disease. Both groups were asked to follow a Mediterranean diet. Raise your hand if you've heard of the Mediterranean diet. Good. And so there were 2 groups. Both of them followed the Mediterranean diet, but one group did one thing different. You know what that was? 4 tablespoons every day of extra virgin olive oil and a handful of tree nuts. And so that's all they did different. And the ones who did the extra virgin olive oil experienced less heart attacks and strokes. After 5 years, they followed up with them. So yes, do the Mediterranean diet. As far as heart trials show, that's the most effective one. But what's even more important? Extra virgin olive oil. Yeah, 4 tablespoons a day. How many tablespoons? 4 tablespoons and lots of good nuts. And the benefits that they saw as far as preventing heart disease, it occurred independently of their cholesterol. Any reduction in cholesterol or total cholesterol or LDL. How about that? Yeah. So it's a little thing that you can do that makes a big difference. So the clogging of the arteries comes from inflammation. And you can trace that back to sugar and bad fats. Which 2 things? Sugar and bad fats. Okay? So remember, that comes from the original food pyramid where the 60% of your diet they should be grains and breads and pasta, rice, potatoes, cereals, and all that. Okay, so this is obviously what we want to change to. Low sugar, good fats, anti-inflammatory, which is primarily what the Mediterranean diet is an anti-inflammatory diet which shows the strongest evidence for protection for heart disease. That's what studies show. And so when you look at that, what do you see the base there? Vegetables, fruits, whole grains, olive oil, beans, nuts, legume seeds. A couple of times a week, have some good fatty fish. A couple of times a week, have some eggs, dairy, chicken, and then less often meats and sweets. Anybody here, if you are considering the Mediterranean diet, you can easily access that on the internet. There's lots of it. It's free, all that you need, but I wanted to make sure that you knew which direction to point your ship in with this, and not to worry about the saturated fats. Not to worry about the bad fats. The bad fats are this. The seeds, the seed oils, the fake butters, the smart balance, right? So, all the times in all the research, there's 340,000 people that went through this in the American Journal of Clinical Nutrition, and they were advised to reduce their saturated fat intake. What did that do for their risk of heart disease? Nothing. No reduction in death rates, heart attack, or stroke. So, can you have red meat? Can you have all those things? Yes, in moderation. But if you're gonna have red meat, what do you want to have? Grass fed. Yeah, grass fed. So you want to have your good fats also there. Saturated fats. Saturated fat is actually the preferred fuel for the heart, by the way. So grass fed butter, coconut oil, all these good fats. Not just the extra virgin olive oil and all this, but the saturated fats, the good fats. You want to have a good abundance of that as well. The supplements were in your handout. Many of you are familiar with why you need vitamin D. We talked about the EPA, how important that was, the CoQ10, and then the Neuromag, which is a form of magnesium, which crosses the blood-brain barrier. So it's not only good for your blood pressure and your heart health, but it's also good to help you sleep. That's why all 4 of these supplements were chosen for the supplement suite. When you're at the workshop, it's the only time that we discount the supplements. So if this is something that you need, or you want to start using some of these, now's the time to buy them. The resources are limited. We just got a shipment in. We were waiting over a month for the Ultraplex EPA, or 2 months. Was it 2 months? Yeah. We just got the shipment in, and I know people are waiting for it, so it's going to be gone pretty quick. So get some of that before you leave tonight, and you'll save 15% of all of that. And then last but not least, just make application with what you were talking about. If you're a guest or you want to get one of these health certificates, make sure you do that, make an appointment for that. If you want the body composition analysis or the omega-3 testing, ask them specifically what you need, and they'll make the appropriate appointments. Again, more important than information is application, right? You guys are awesome. Love and appreciate you. Thanks for coming tonight. God bless.